Hi there, Dr. Emma Foraker. Today I'm talking about how to do filler for nasolabial folds and marionette lines. So first I want to talk about nasolabial folds, one of a very common place of concern for people as we age. And I think that my technique, I have kind of put together a few different techniques and have made a very effective way of treating the nasolabial folds, so we're going to talk about that today. So the first thing I always do when I'm doing a nasolabial fold filler consultation or procedure is I'm going to evaluate the piriformis fossa. The piriform fossa is the space right next to the nasal ala on both sides, and it's a very common area for volume loss. And when you restore volume to this area, it really will support the midface and kind of improve the appearance of the nasolabial folds just by putting filler in this area. So I think of it as this little triangle here that we're putting filler into, and it's going to be a deep periosteal injection down to the bone and a depot injection. Now this is a high risk area because you have your angular artery that comes up to the nose right in this area, but if you stay medial, you're down on bone, and you aspirate before you inject, you can do this safely. So I go down to the bone, I aspirate, I do a depot injection here and here. I don't know, I'm thinking maybe 0.2 to 0.3 in each piriform fossa, just based on how much the patient needs. Next, you're going to do a fanning technique into the nasolabial fold itself. Now you have to really, I think with this filler procedure, you have to set patient expectations, because unfortunately, there's no way that we can get rid of our nasolabial folds. Everyone has them, and they're a natural part of our anatomy. But what people don't like is often when they're creasing really badly and leaving, lines in their makeup. And for that, we can absolutely improve the appearance of them. And so what we're going to do here is we're going to use a pilot hole, and it doesn't matter if you use a needle or a cannula. I think cannulas are a more advanced technique, but I definitely think that this cannula, if you're comfortable with using a cannula, can be really a better tool to use in this procedure. But again, you could potentially use a long needle. But anyway, your entry point for your pilot hole is going to be around here, and you're going to fan the filler through this pilot hole. I mentioned this in the course earlier, on this slide, but importantly, you do not want to fill the lateral aspect on the nasolabial fold. You want to fill medially. Why would that be? Well, if you think about it, if gravity is pulling down on their cheeks, they're losing midface volume, and you put more heaviness, you put more weight into this area here, what's going to happen? It's going to worsen their nasolabial folds. So whenever we're actually trying to fill superficially that line itself, you want to come from a medial aspect to try to fill from a medial aspect, because again, you don't want to add bulk here, which again will cause worsening of the nasolabial fold appearance. So you're fanning the product in very thin threads. You can do, a lot of different techniques here. But basically you're just trying to fill the line so that it doesn't have a crease there. Now for the marionette lines, very similar. You are going to fill in a fanning technique. I usually don't do it unless they have a huge deficit in their pre-jowl sulcus. I might do a depot injection to kind of fill out their jaw, but for the most part, I'm just doing a pilot hole right here and fanning in all of this area, pre-jowl sulcus, into the marionette lines themselves, and to soften the appearance. So pilot hole here, cannula or needle, to fan in this area. Same idea. We don't want to fill laterally because again, we don't want to accentuate the appearance of the marionette lines. Of course, you're going to blend it a little bit, but most of your product is going to be in this area, in the medial aspect of, medial to the pre-jowls, or to the jowls rather. And so that's how you do marionette and nasolabial fold filler. Keep in mind, you can go through a syringe of filler pretty quick in this area. So usually I would say at least 2 syringes of filler for the nasolabial folds, 2 syringes of filler for each, 1 for each marionette line. So if you were going to do nasolabial folds and marionette lines, if you wanted to do it adequately, you'd probably need around 4 syringes of filler. But you could potentially start with less than that, see how the patient likes it, and they can always come back for a touch-up. If you have any questions about this, please let me know in the comments below. I hope you have a good day.